Alzheimer's, how to avoid it. Learn how to avoid this dreadful disease. Welcome to the channel, subscribe, leave your likes and post your comments. Alzheimer's, study suggests healthy lifestyle can stave off symptoms. Studies show that good habits can even prevent the onset of disease. Alzheimer's disease is a neurodegenerative disease that impairs brain function. As a result, it can lead to memory loss, difficulty speaking, and decreased self-care skills. The cause is still unknown scientifically, but genetic factors are believed to be decisive. The most common symptoms of the disease include memory loss, insanity, delusions and paranoia, repeat questions and statements, difficulty finding the right words to express yourself, difficulty in distinguishing, restlessness and aggression, loss of exercise capacity, incorrect positioning of objects, mood and personality changes, impulse, twitch, difficulty swallowing or dysphagia. According to a report by the World Health Organization, WHO, the number of people living with dementia is expected to triple by 2050. With this, the number of patients diagnosed with Alzheimer's should grow at the same rate. There are 4 stages of the disease, namely, initial, moderate, severe and advanced, in which neurons degenerate over time. While there is no cure, it is possible to stop the progression of symptoms. Search. Alzheimer's patients may not show clinical symptoms of the disease, such as dementia, a study published in the scientific journal The Lancet Neurology has concluded. According to the survey, the secret to this phenomenon lies in maintaining healthy habits and an active life, even at an advanced age. To reach this conclusion, the researchers evaluated 456 older men and women in the Memory and Aging Project. After the participants died, the brains were analyzed to determine whether any of them had dementia. The results showed that 8% of older adults had brain changes associated with Alzheimer's, but they did not show any symptoms. Already 11% suffered from the problem, however, they had few of the brain plaques that are characteristic of the disease. Asymptomatic patients have less fatigue and no joint, mobility, and heart problems. Additionally, they are able to prepare meals, which is a sign of good health. People with less frailty may be able to better tolerate the symptoms of the disease, according to the findings. At the same time, frail patients are more likely to develop dementia, for example. How to prevent? Key preventive measures to prevent or reduce symptoms of Alzheimer's disease include: avoid stress. According to a Danish study conducted by the University of Copenhagen, stress increases a person's likelihood of developing dementia by 40%. Therefore, avoiding stressful episodes is one way to prevent the development of Alzheimer's. Avoid too much aluminum in your body. A study by Keele University in the United Kingdom found that the brain tissue of Alzheimer's patients had high levels of aluminum. Metals can be absorbed into the body through food, breath, and skin. Therefore, to avoid this harmful factor, some measures are recommended, such as: choose to use aluminum-free cosmetics and hygiene products, check product packaging. Cook food in stainless steel, glass or porcelain pots if possible. Avoid canned products as much as possible, because if the product is acidic, aluminum can enter it. Take filtered water as an example. Filters with activated carbon are preferred. Additional precautions. Maintain adequate blood sugar levels while avoiding diabetes. Always aim to maintain your weight at a healthy level, usually below a body mass index, BMI, of 25. Avoid head trauma, such as concussion. Always be active in reading and learning new things. Seek emergency medical attention if you have orthostatic hypotension, such as repeated dizziness when standing up. From the age of 40, try to keep your blood pressure level stable. See your doctor if you experience hearing difficulties, as hearing loss has been linked to damage to areas of the brain associated with memory. Avoiding high levels of homocysteine, an amino acid that can cause blood vessels to clot and damage arteries. Get regular physical activity, at least 30 minutes a day is recommended. Consume foods and fruits rich in vitamin C. Reduce alcohol consumption, smoking, quit the habit if possible, and exposure to air pollution. Get high-quality sleep, averaging 8 hours of uninterrupted sleep per day. For women, avoid postmenopausal estrogen replacement therapy. Do not take dementia medicines as a prevention without a doctor's prescription. Important. Alzheimer's is an incurable disease, but early diagnosis and appropriate treatment can help prevent and relieve symptoms. In this way, the patient's quality of life is slightly improved, and the pain of family members and caregivers is reduced. If you like it, please sign up, leave your likes and leave your comments, as this will spread YouTube to more people and help spread this message.